Okay, so the next part of the training is about talking about suicide to the person. And this is a vital part, very, very important. And it can provide valuable information about whether he or she is at risk of suicide and what problems should be addressed. And remember, talking about suicide, asking and listening will not hurt the person. It will not cause him or her to attempt suicide. And it will probably help you to understand that he or she is at immediate risk, or maybe at immediate risk but has problems and needs some help. So that's why talking directly about the issue can really help a person. And we all know that it's how you ask the question is more important sometimes than what you ask. And don't tell them that their problems are not important. Use a friendly but matter-of-fact tone. You shouldn't sound like you're conducting a clinical interview, and neither should you appear panicked or anxious when talking about suicide with the person. So you want to have a serious, compassionate conversation, and compassion is important here. And again, without passing judgment. When you don't pass any judgment, it shows that you're concerned for the person's well-being and want to understand their pain. Passing judgment will not help. Keep an open mind to their problems and feelings, but don't pretend you have all the answers. It's important to talk, ask, and listen. Asking somebody openly if they are thinking of killing themselves will not push them over the edge. The best thing you can do is to help the person connect with resources and talk to them about the situation. The statistics show us that when talking to a person about these issues really help them, and they really want help. And when you talk to them and listen, you're showing that you have compassion and that you really care, which is very important. Again, things to ask. How are you doing? Would you mind talking about how you feel? Tell me more about how you feel. Do you have thoughts about suicide? Have you been unhappy lately? These are kind of indirect questions that'll get the person to open up, and then you can listen to them compassionately and listen to what they have to say. There are good questions to ask, and there are bad questions to ask. So let's look at some good questions to ask. When people are as upset as you are, as you seem to be, they sometimes wish that they were dead. I'm wondering if you're feeling that way too. And, a direct question like, are you thinking about killing yourself? And it's very important. If you can't ask these questions and be able to ask and listen, find somebody else. Find somebody else to do this. Or this could be a crisis situation. So you want to be able to call one of the 800 suicide numbers and get the person some help. And here's some questions that really you shouldn't ask. For instance, you're not thinking about suicide, are you? You don't want to pose the question like that. It's panicky, and you're much better off asking a direct question and telling them that don't talk like that. It's foolish. Again, that's judgmental, and it doesn't open up the conversation. It's kind of insensitive, and so think judgmental stuff like our problems are never as serious as we think they are. What you're trying to do is you're trying to ask a direct question here to open the conversation up so as you can listen, and by listening you'll show compassion, and that is where you get the person's trust. They'll begin to trust you. It is a kind of a trust issue also, that you want them to be able to trust you, to be able to, and you show them that by listening, and that's where the compassion comes in. And then we'll talk about offering hope, and hope is what we're trying to get here. We're trying to intervene with hope. So if you're in doubt, don't wait. Ask the question. If the person is reluctant, be persistent. Talk to the person alone. Take them to a private place. If this is in a place where there's people around and somebody else is listening, then it probably won't work out too well, because you want to allow the person to talk freely. It's very important to give yourself plenty of time. Don't be anxious. Don't be looking to looking at your watch. That's not the way to show compassion. And what you want to do is show compassion here. So, and have your resources handy, have phone numbers handy, counselors' names, and other information that might help. Remember, how you ask the question is less important than what you how you ask it. So it's important to ask the questions directly. And finally, in talking about suicide, you want to realize that that somebody might be suicidal, that this could be a real crisis situation. So reach out to the person. Again, ask the suicide question. And it does not increase the risk. Listen. Listen intently. By listening, you're showing compassion. Talking things out it is proven that it can save lives. And don't try and do everything yourself. Don't promise secrecy, and don't worry about being disloyal. The person's life could be at stake here, so you don't want to worry about being disloyal. And if intervention fails, you want to call your mental health center, local hotline, or emergency services. So we've talked about things you can talk about with the person. Now I want to move on to intervention, and intervention with hope. So this is the next step after talking to the person about suicide, asking direct questions. You want to intervene. We call this intervening with hope. And we know from studies that all efforts made to intervene will give somebody hope. Instead of attempting suicide, when you want to intervene and show that you care, it'll probably be met with agreement and relief. People want to talk to somebody about these things. They want to know that you care. So don't hesitate as a minister and clergy. Don't hesitate to get involved and take the lead. Don't hesitate to give the person hope and show you care about them. And again, the goal is pretty simple. You want the person to say yes to your suggestions of help and hope. Would you come with an appointment with me to somebody? Will you go with me to a counselor or a minister or a healthcare professional? And you want to take them there. If that is the best thing to do, is if you could take them there. Again, it's all about showing the person you care, and then they will listen to what you have to say and your recommendations. So listen to the problem. Listen to them talking about what the problems are, and give them your full attention, and really listen. And again, do not rush to any judgments. Try not to interrupt the person, and then offer hope in any form you can offer hope in. Again, we will go through another teaching here for suicide prevention training from a Christian perspective, and we'll spend quite a bit of time, about an hour, talking about hope and how we have hope through the Bible and through the Word of God. And that's how I've been ministering to people for the last 6 years, and it has worked. When you can minister to a person and you give them hope from the Word of God, and show them that they're loved, show them that they're not condemned, it really helps a person. But for any faith, and as a minister and part of the clergy, offer any kind of hope in any kind of form, and your willingness to listen and help will rekindle hope. If someone you know exhibits warning signs of suicide when you're talking to somebody, then there's a few things you might want to know and make sure that you take these steps. Try not to leave the person alone. That's obviously a major issue. Remove any firearms or alcohol or objects that could be used for a suicide attempt. Take the person yourself to an emergency room or seek help from a medical professional. Call, or if you can't do that, you can't take them somewhere, you want to call one of the hotlines. The Lifeline is here, the U.S. National Suicide Prevention Lifeline. So if the intervention fails, call the call your mental health provider, local hotline, or emergency services. So offer to work with clergy or therapists, psychiatrists, or whoever is going to provide the counseling or treatment. Usually the counselors will communicate with you after the release of information form has been signed. And then as a minister or clergy, you can follow up with a visit, a phone call, or whatever you feel comfortable with. But letting the person know, and you know that you care about them, when you follow up, that's what will happen. And remember, when you intervene, you plant seeds of hope, and it's been proven from lots of studies that hope helps prevent suicide. And again, this is the way to show a person that you love them. So thanks for having enough love to act, because that's what it's going to take. It's going to take some action on our behalf as ministers. Now we move on to getting help, or what we call referring somebody. So suicidal people often believe they can't be helped. So you may have to do more as far as intervening with compassion and hope, and persist. So the safest option involves taking the person directly to somebody who can help. That's the safest option for you to get involved directly. The next safest option is getting a commitment from them to accept help, then making the arrangements to get that help. Another good option is trying to get a good faith commitment not to complete or attempt suicide. Any willingness to accept help at some time, even in the future, is a good outcome. So again, here we're trying to get the person some help, and we stress again, compassion and hope are the keys, and having that person understand that you really care. Since almost all efforts to persuade someone to live instead of attempting suicide will be met with agreement, so you don't hesitate to get involved or take the lead. And if you can't do this as a minister or a clergy, get somebody who can. Say something like, "I want you to live. I'm on your side. We'll get through this." Again, the compassionate offer of hope. So we want to get others involved. Family, friends, brothers, sisters, pastors, priests, rabbis, physician. Get somebody else involved. If someone you know exhibits warning signs of suicide, there's a few things you want to do. If you can, do not leave the person alone. That's number one. If you can't, then try and get some help from somebody else. But if you can do it yourself, it'll be better to stay with the person. Remove any firearms, alcohol, drugs, or sharp objects that could be used in a suicide attempt. Call the U.S. National Suicide Prevention Hotline at 800-273-TALK. Take the person to the emergency room or seek help from a medical or mental health professional. On to protective factors for suicide. Obviously, healthcare and emotional health care and treatment for depression, substance abuse treatment are very helpful. And then the promotion of health and wellness, personal characteristics, and so forth will help. The sense of meaning and purpose. Again, the hope is always coming into play here. A person's self-esteem, skills in coping, problem solving, conflict resolution, and non-violent handling of disputes. And cultural and religious beliefs that discourage suicide and support self-preservation. And that, as a minister and as the clergy, that's part of our job. I see myself as a minister in this area, and I'm bringing hope to people, and I'm trying to discourage, the suicide and support self-preservation. Some more protective factors. A person's living situation. Obviously, if it's positive and pleasant and home-like, it makes a difference. Restricted access to highly lethal means of suicide is also a positive factor. Relationships, strong connections with family, friends, and the larger community. Again, this has been proven to really help a person. And engagement in purposeful activities, including recreational, social, spiritual, intellectual, and creative design around the likes of and needs of people. And this is a lot of times these situations and relationships related to suicides among the elderly, which those numbers are high. So we need to do a better job with helping elderly people in these situations. In this section, we talk about getting help or referring a person to somebody that can help. Suicide people often believe they cannot be helped, so you may have to do more. You have to talk to them, again, as we talked about, talk and listen, intervene, and with hope. The safest option involves taking the person directly to somebody who can help. That's the best option, taking them yourself to somebody who can help. The next safest option is getting a commitment from them to accept help, then making the arrangements to get that help. Another option is to give referral information and try to get a good faith commitment not to commit or attempt suicide. So any willingness to accept help at some point, even if in the future, is a good outcome. Some more risk factors: mental illness, major depression, other mood disorders, psychiatric disorders. So if you're working with people already or you're talking to people, you look out for these risk factors, because if you get involved with a person, you may be able to really help them. Substance abuse and misuse, prescription and over-the-counter medications, poor physical health, functional impairments, a lot of pain, side effects from some medications, and insomnia. Previous suicide attempts, a family member who has died by suicide, major life transitions such as moving to a new setting, family conflict or loss, financial problems, losing autonomy, respect. These are risk factors for suicide. So it's good to know these risk factors. It's good to know, to be able to see if these factors, if these personal characteristics are in somebody you're already working with. Again, what the idea here in this training is to become aware of, when you talk to people, what might be some factors, risk factors for suicide. You see here again, hopelessness, very common. Most of the people I've worked with over the last 6 years, they've all talked about hopelessness. So we've got to come, as a minister and as clergy, we've got to come at this point of hopelessness and offer hope. Cultural or religious beliefs favorable to suicide, especially among older people. Fear, and again, for older people, fear of becoming a burden to others is a very common risk factor. So it's good to study these risk factors and know them, and be able to identify them when you talk to people, that these might be risk factors for suicide. Again, the more you know about this issue, the more we as ministers and clergy know about this issue, the more we will help to reduce suicide. So this is the end of the suicide prevention training for ministers, counselors and clergy of all faith. This is the end of part 2. If you want to get back to part 1, just look it up on YouTube, suicide prevention training, and you can find both videos on YouTube. We also have a Christian suicide prevention training, which we emphasize. This is completely different. We're talking about Christian suicide prevention training will emphasize the Word of God only, and we concentrate and focus on the Word of God. So if you're looking for the Christian suicide prevention training, you can also go on YouTube and look that up there.